Hmm. Hi, everybody. Welcome. So we are going to let everyone trickle in. And while we're waiting for people, feel free to jump into the chat, say where you're located, how far along you are, or if you have already had a baby, how many weeks postpartum you are, just so we can kind of get the conversation going. And we'll give everybody a couple minutes to join in because I see a bunch of people come in. Brooklyn, 27 weeks. Planning mode, we love that. Everything.
Can I put my own in?
Yeah, do it. Well, I'm 6 months postpartum. What about you? You're how far postpartum? Elizabeth, you are.
Oh, yeah.
A year post, right? Oh,
I'm 1 year. Yeah, 1 year postpartum.
Yeah. Third baby, 20 weeks. 4 years postpartum. 38 weeks. Melville, New York. 12 months postpartum. 24 weeks first baby. 18 weeks.
11 days.
This is amazing. All the babies. Love it. It's so fun. Massachusetts, Colorado, Long Island, New York. Amazing. Okay, let's give it another. Oh, thank you. Thank you.
Love it.
Amazing. Southern California. Great. We are, half the panel is New York, half is California. Elizabeth, you're in California, right? You're in Los Angeles.
I am. I'm in LA.
You're in LA.
Yeah.
Eric and I are in New York. And Liz, you're in
I'm in SF.
San Francisco.
Yeah. To make it confusing for everybody to have a Liz and an Elizabeth. We're both West Coast.
Right, have both. Okay, amazing. All right, so let's get started, and I'm sure people will trickle in, but I wanted to welcome everyone. Thank you so much for being here. As you know, we are here discussing the pelvic floor. We'll get into what that actually means, because I know I am excited to hear about from these amazing panelists who are experts in this field, and to be here as a postpartum mom who probably should have done a little bit more work prior to giving birth, but I don't think there's ever, it's never too late, I would say, hopefully, to work on your pelvic floor and get there. But I'm really excited for the women that are expecting or planning, so they know kind of how to go about it with to take care of themselves. So I'll introduce myself. I'm Nikki. I am the head of community at Hatch. So I kind of put all of these events together and kind of put together topics that I know will resonate with our audience on what us as women going through pregnancy, pre-pregnancy, or postpartum are going through, and who is there to kind of support us during this time, because there is a ton of support out there. And so we're here to kind of mind the gap between that and introduce you to the amazing people that are doing the work to support women, and parents. So I'll kick it over. Liz, you want to introduce yourself? And who
Sure.
you're doing here?
Thanks. I'm so excited to be here. My name is Liz Miracle, and I am the clinical director for Origin in San Francisco. It's a physical therapy clinic. We have several locations in LA and San Francisco, and then also we have telehealth in New York and Texas, but really focused on physical therapy for women, mothers, parents, people with vulvas. And I'm also their head of clinical quality and education. So making sure that everything we're doing is evidence-based and really just trying to make it accessible for people, because it can be really challenging to try to find some of the answers that you're looking for. And it's so exciting to have people on this panel together. But I think that's something that people really struggle with, is trying to find accessible care. So we're doing that with a blended model of both virtual and in person, and we accept most insurance, which is great. And a little bit of background about me. I'm also an assistant clinical professor at UCSF, their physical therapy medical school here, where I teach the pelvic floor portion of their curriculum. And I also helped write and teach the American Physical Therapy Association's content for pelvic health certification, and was the head of their committee for 5 years. So I've done this with PTs, patients, all around the board. And it's a huge passion of mine. I love it. So I'm so excited to be here. So thank you very much.
Well, we're so happy to have you. Amazing. And Erica, you want to take it away?
Hi. Thank you for having me. I'm Erica Bloom. I'm the owner of Erica Bloom Pilates. We have studios in New York and in LA, in the Hamptons and in Turks and Caicos. And we specialize in postpartum recovery using healing movement and body work. And we also do natural birth training and preparation for birth. And I got into this because I was originally a fitness expert, and then I had my own kids. My kids are 10 and 12, and I had a 6.5 finger diastasis and a lot of pelvic floor dysfunction. And I went on the journey of healing it naturally for myself, and then started to see my clients going through similar struggles and not having enough resources for that. So we send them to PT, but then we also create programs for them that they can take forward into fully healing and dealing with these sorts of core and pelvic floor issues as women, not just initially postpartum, but in the way that they carry through as we age, as we go into menopause, etc.
Amazing. And last but not least, Elizabeth, do you want to
Yeah.
yourself?
So hi, I'm just a normal person. I don't have any
Yes, you
expertise.
are. That's part of the
So-
conversation. Yeah.
Yeah. So I'm a partner at an investment firm in Los Angeles. I'm also a mom of 3 kids. My kids are 6.5, 3.5, and 1. And I've been a patient of Origin for the last 7 years. So I'm happy to give you guys my perspectives on, my experiences and what I've learned along the way.
Amazing. Okay, well, we are so excited to have you guys. Thank you all for being here, and thank you to our participants that are here. And we'll get started. And just so everyone knows, a few things before we get started. I might be looking here a little bit because I have another screen and I just want to keep track of everything, but I am here with you all. And if everybody, anybody can use the chat function to ask any questions that come up. We'll try and kind of monitor that as well as we go through, but we did get some amazing questions from you all when you RSVP'd, so we'll be trying to tackle all of those within the hour as best as we can. So great, so we're gonna start off. I think the best place to start, Liz, if you can actually walk us through what is the pelvic floor and kind of the important role it plays even pre-pregnancy, during pregnancy, and then postpartum. I know it's
Just all of it.
Just all of it. Like,
Here we go.
what does that even mean? Because I think it's such a buzzword, not even a buzzword. You hear about it a lot more once you start getting pregnant, and like, why do we care about it? I guess.
Sure.
Yeah.
Let's talk about it. I've got a pelvic floor here in my hands too, so we'll go over it a little bit. But basically, it's just a set of muscles and ligaments that support the organs of the pelvis that are situated, and they call it a floor, but I like to think of it as more of a hammock. So if we're looking at the pelvis like this, you can see that there's kind of a bowl inside of it that's creating like a little hammock, and that's holding up all of your organs. So your uterus, your colon, your bladder, and that's all sitting there. But it's doing a lot more too. It's providing support also to the bones of the pelvis, right? So you can actually see that there are attachments with the muscle to kind of the front pubic bones and the back of what some people think of as a tailbone, but we actually call the sacrum and the SI joints here, and provides stability. So if you've ever done yoga and tried to stand on one leg and then try to contract your pelvic floor, you're going to see a difference in your balance with your stability. If you're contracting the pelvic floor muscles, you're going to notice a difference in your ability to hold your organs up. So if you've had a baby and you're experiencing some heaviness in the vagina, you'll notice when you do that hold and that lift, it can provide support there. It also stops you from leaking gas and urine. So by contracting those muscles, you can hold back urine and gas. And then it also plays a role in sexual pleasure. So being able to contract your muscles around your partner or a toy, or even be able to rhythmically contract the muscles in order to propagate an orgasm. So, and we do have different layers to the pelvic floor, so I don't like to get too in depth with it, but I do like to talk about it in terms of like, you'll often hear 3 layers from people. So if we take it apart and take this is if a person was lying on their back with the vulva facing you, you would see the clitoris at the top, and then this little muscle, which is the perineal muscle, which you often will hear of people talking about that perhaps tearing in childbirth. That's the muscle that spans from sit bone to sit bone between the vagina and the anus. And this whole little layer, if I just take that off, encompasses actually the first 2 layers, the pelvic floor. And then you have your third layer, which is the deeper hammock that I was showing you earlier, that encompasses what people often call the PC muscle or pubococcygeus muscle. If you've been reading any of those like hot buzzword articles that talk about the PC muscle, that's actually the deeper muscle. And these muscles actually need to contract in different ways to do different things. So that's part of what we do, is making sure that the muscles are contracting in concert with increased intra-abdominal pressure in the abdomen, and determine, like, basically based on what it is that you're having an issue with. These muscles can also become dysfunctional and too tight, which can cause pain and other disorders. So there's really, I always like to say, I like for the pelvic floor to be Goldilocks. I don't want it to be too tight, and I don't want it to be too loose. I want it to be flexible and strong and like right in the middle. So that's kind of a quick and fast pelvic floor 101. If there was anybody who had any specific questions about those, you probably noticed there were a few other muscles on here that I didn't point out. These little flappy doodads right in here. These are actually hip muscles. That's the obturator internus. And a good portion of our deeper pelvic floor actually attaches to those muscles rather than to bones. So the function of our hips has a lot to do with how our pelvic floor acts as well. So we'll see dysfunction and problems in people who are ballet dancers and doing a lot of turned out positions and don't have good hip internal, external rotation. So it's all, everything is connected basically, which I think Erica, I'm sure, could tell you all about. That's kind of her whole shtick, right? Is that it's movement. We're like everything is structural and functional.
Yeah, Erica,
Yeah.
do you have anything to add there?
Sure. Yeah. I mean, especially because I approach analyzing the body by reading the fascial system more, being a structural integration therapist and using full body movement. And the pelvic floor so much affects organ alignment, and the fascia of the organs then comes up and affects our posture all the way up and all the way down. So it isn't just local, the consequences that it has. And I also like to address it not just for pelvic stabilization, but also as a muscle of respiration. The way that it works, you were I don't remember the analogy. Oh, a hammock. I like to call it. I like to call it a jellyfish, right? So it does these things like this, and then the diaphragm does as well. And they sort of work to balance posture and also assist with organ function. So,
oh my God, I love that. I think a lot of people don't realize the pelvic, it's actually called a pelvic diaphragm. So you've got your breathing diaphragm and your pelvic diaphragm, and they need to work in concert, which is probably part of your journey with your diastasis, DRA, your diastasis and pelvic floor dysfunction, that it all actually needs to like work together. Yeah,
absolutely. Yeah.
I feel like that's with everything. Like, I feel like everything's connected. So like when you talk about like one part of your body, I feel like it really affects, it's really about focusing on everything, and like it can account for a lot of things. So interesting. Thank you. And Elizabeth, I guess my next question is for you. I know you've been a patient of Origin for some time, and I kind of want you to talk through what prompted you to go. Yeah. Why have you been going? How long you've been going? What your experience was? Can you talk about that a little?
I'm a long running patient. So I first started going while I was in the middle of my first pregnancy, and I was starting to get those like aches and pains, like particularly around my tailbone. And one of my girlfriends who had a baby a year before me had recommended that I go to Origin, and just talking about how you get all those aches and pains worked out. So, and it was amazing, having that. It was something that I look forward to every week. And I remember towards the very end, I was probably about 38 and a half weeks pregnant. And it ended up being, I didn't know at the time, but it was my last session. And as I was leaving, they're like, okay, baby, we'll see you next week. Maybe not, but if not, we'll see you after that you have the baby. And I was like, why would I come after I have the baby? I mean, isn't this all going to go away? Like once I give birth to the baby? And I realized no. So I came back, I think it was like 6 weeks after I had the baby. I had the baby via C-section. I had diastasis. And I also just ended up having a lot of other, just issues that came up. I had mommy thumb. I was just having, it's like tendonitis in just by holding the baby improperly. I just didn't know. Yeah. And so that's, what kept me after the first one. And then when I had my second baby and I was pregnant with my second baby, of course, I came in like very early on when I was just trying to deal with the pregnancy itself. But I had also decided at that point, like, kind of knew what I was kind of going to be in for after I have the baby, and I kind of had this overall outlook on self care, and some of those things were, while I'm on maternity leave, the baby's really young. I'm going to try to carve out some time during the day for myself to go work out, get like, hipster lattes, and then one of those things for me was once a week I was going to go and do my physical therapy. And the physical therapy was crucial for me because it helped me deal with, specific things that I knew I was going to deal with, like diastases, but also helping me uncover things that were kind of wonky, but I just didn't really quite understand at that point in time. So it was super helpful for me. And so that's just always been kind of, and now baby number 3 was just part of my plan.
Yeah, amazing. And I guess so you've been doing it since the first. Were all of them, I guess, the same pregnancies, or did you see anything that like came that made it easier because of going to Argent? I guess you can't compare it because you've been doing it since the beginning, which
yeah, they were all just slightly different though. I mean, they were all C-sections, so there were some elements of it that I knew I was going to be dealing with, but I carried the babies differently. So I just had different types of aches during my pregnancy. So the kinds of exercises my regimen was just different.
Different. So it would change depending on, yeah.
Mhm. And then postpartum, some of the issues were the same, and the new ones just pop up.
Yeah.
Get older, unfortunately,
Unfortunately, yeah. And
Yeah.
Liz, did you add in anything from like an Argent? Do you see a lot of patients like Elizabeth that are coming,
Oh yeah. What I love about what she did is that she actually went before, because I feel like there are a lot of, in reality, physical therapy tends to be reactionary for a lot of people. So then they have the baby and then they find out there's something wrong, because typically what I see is that people go to their obstetrician and they say something hurts, and then the comment that they get back from their obstetrician is, well, once you have the baby, everything will be fine, so just don't deal with it, or don't work on trying to fix your problems because you're going to have a second child, and so why don't you just wait until after you have all of your kids to fix your problems. But you would never tell an elite athlete if they tore a muscle running a marathon, like, no, just go ahead and run like 2 more marathons. And when you're done running your marathons, then we'll deal with your rehab on the other side of that. That's ludicrous from any other standpoint in our society. But for some reason, we just tell moms to like suck it up and deal with it. And then we'll deal with it on the other side. In reality, there's so much you can be doing, like your prehab ahead of time, to mitigate the consequences of what can happen, so that you don't have to deal with as much on the other side. We have research that shows that if you do pelvic floor strengthening prior to birth, you will have reduced issues of urinary incontinence postpartum than if you do the pelvic floor exercise after birth. And I think a lot of that has to do with that neuromuscular integration and actually making the connection between what's happening in your mind and your body, because the stronger you can make that connection and learn it to begin with, the easier it will be on the other side to like reform that connection and jump right back into it. Whereas if you're now dealing with muscles that have been stretched or torn and you never knew how to connect with them in the first place, it's really hard to then try to find them. It'd be like if I ripped half of your ear off and then I said, now try to wiggle your ear, if you didn't know how to wiggle your ear in the first place.
Yeah. It's like, I guess it goes against, really it should be maintenance. It shouldn't be like this reaction, if something's wrong, I need to fix it. It should really be, we're taking care of ourselves so that we're working to prevent something from happening. And I think that like is a lot about how, we could get into like our healthcare system and all of that.
Yeah.
I think it's bigger than just this conversation, but it also comes to light that like a lot of other countries get this support postpartum. I know we should have it before, but they get it and it's inclusive of their care. And I think it's a lot. I don't know if we have anybody that's not from the US here, but a lot of US care, we're not treated to that here in the US. And so we have to rely on experts like yourselves to kind of support us during that. So yeah, that's so helpful. And Erica, anything to add?
Yeah, I have clients where, they go in post-birth and they say, this doesn't feel right. And the doctor says, but your baby's so beautiful. And there's really a denial
It can't
of,
be both. Like,
yeah, right. Why can't it be both? We can care
yeah,
for ourselves and care for our child, and care for our child better when we're caring for
I
ourselves.
mean, that's a
But
whole
I
other conversation.
That right, yeah. I find that when we do, let's say someone has a baby and they have diastasis, even if they're going to have more children, if we do the diastasis recovery, and so then they're now stronger in their diaphragm and in their deep back muscles and in their pelvic floor, their next pregnancy goes better. It often won't reopen, and then their labor goes better as well because they're so connected into those muscles. Because maybe the disconnection or the imbalance that caused the diastasis or the pelvic floor dysfunction from their first pregnancy can be remedied in between and then lead to healthier pregnancy, labor, and delivery and recovery after. So that happened with me, where I closed my diastasis between my two children and then it didn't reopen. And it's yeah, I agree very much to not wait until you're done, but to do that care before and in between.
Yeah.
Yeah. I mean, for
I
sure, for
will,
me, the diastasis work was really hard my first time because I didn't really have that awareness of my muscles,
Yeah.
and then the pregnancies thereafter were for sure a lot easier.
yeah, instead of starting at 0, you were starting at -10, right? And we also know that when you have a cesarean, you're more likely to have a diastasis. And it's also more likely to be the type where the physician has sewn you up at the lower part of your belly, and then they leave you gaping at your umbilicus, your belly button and above. So it's a little bit, it can be challenging because it feels closed at the bottom, but you feel completely disconnected from those muscles. And then you're gaping in the center and you have this like shelf of a belly that you don't know how to get in. So that can be really common.
Yeah, can someone step back, either Erica? I don't know if you want to take it on what diastasis is, just for everybody, because I know if you are a first-time mom, like this word, I'm sure you've heard it come up, and you're just like, what the hell are people talking about? So I don't know, Erica or Liz, if one of you wants to take it.
Yeah, sure. So simply, it's when the two sides of the rectus abdominis separate at the linea alba, and the linea alba is from the base of the sternum to the pubis. But it's not a tearing. I mean, we stretch in a connective tissue all the way around. It's more of that area would get more stretched than it should in a way where it loses integrity. And then often the two sides can come back and the body will, lay down new tissue and tighten that up and it'll close on its own. But sometimes it doesn't. Sometimes from a postural issue or the tightness around the back, it'll stay open. And I like to use, you've heard this before, but the analogy of the knit sweater. If we hand wash it and lay it flat to dry, it looks great. If instead we lay it over a bicycle, it's going to get stretched out in one spot so you can stick your hand through the knit, but it's not actually torn. But if you sewed up that place where it's overstretched, that sweater would be unwearable. What you have to do is rewash the sweater and lay it flat to dry, which is essentially rebalancing the different areas and keeping it closed while it's healing.
Is there an ideal time frame to address a diastasis?
Now.
A friend is asking.
No. Do it now.
Yeah. I have clients that are 60 and they had their kids and they were 20 and we're healing it now, right?
Wow.
If you continue with your diastasis as you age, you are, and Liz can tell me if this is still evidence-based, but more likely to have prolapse. And so we say, or back pain or tailbone pain or SI joint dysfunction. So we say at any age you should try to heal it, no matter how long it's been.
Yeah. And how do you know you have it? I mean, Elizabeth, I know you have like this, you figured it out, you had it yourself. Is that you that did you?
Yeah, well, I came in. Yeah, I came in and they
How
did
do you
the
know
big
you
thing
have
and
it? Yeah, I don't know. Is there a way to know you have it, or do you need somebody to actually?
No, there is a way. I don't know if anybody wants, I can pull my computer down to the floor and try to do a quick to show you. But I do actually get a lot of people who come in complaining that their abdomen that maybe they're coming in for it. and they actually don't have one. They just have extremely weak abdominal musculature that can't really bring the tummy back flat. And so they think because their tummy is pooching out that they have one. And in reality, like, it doesn't matter if you don't have one, you still obviously have an integrity issue with your ability to maintain your intra-abdominal pressure if your belly is pooching out like that. So those aren't people that walk in, I go, you don't have a diastasis. Those are people who walk in, I say, you don't have one, but guess what? This still isn't working right. We still have to get this working properly for you. So typically what we would do is have people lie on their back with their knees bent. And you can just take a couple of fingers and place it in the center of the belly, like where Erica was showing us that ligament that's between those two six-pack muscles. And then you do a little bit of a curl up. So one of the things that is important, which I think we don't see a lot between practitioners, is that when you are lifting up to do that curl up, you want to make sure that you're lifting up the same height every time you do it, because if you lift up higher or lower, it may actually change the amount of separation that you're seeing. So one of the rules that I always use is I just wait until the tip of the shoulder blade is like still touching the table, but they've come up. So that way I know every time that's exactly how high they're doing their curl up, so I can measure it. And then you want to look at the separation below in the center of the belly button and then above the belly button. But as the years have gone by, I've gotten less concerned necessarily with the width of the separation. So you'll hear some PTs say, oh, if it's under 2 fingers, you don't need to worry about it. For me, if your separation is less than 2 fingers, but I can still take my fingertips and touch your spine through your abdomen because there's no integrity in that linea alba, again, that's a problem. It doesn't matter that it's a narrow width. If it doesn't feel like a trampoline in the center, if it feels like silly putty, that's not good. And in the same token, sometimes you might see people with a little bit more of a separation, but they have really good ligamentous integrity and firmness, and they're able to combat that intra-abdominal pressure. So really looking at, like she said, like, how is that sweater knit to make sure that it's performing the function that it needs to perform for the person.
Amazing.
But it's a curl up. Yeah, it's a curl up, and then you just press your fingers in the center. And when you do it and you wiggle them, can you kind of do you feel like a separation between those six-pack muscles? Can you feel those borders on either side?
As I try and do it. I guess another great question is there anything to prevent diastasis while you're pregnant? Like, is there anything to do that can kind of...
I'll let Erica take this one in terms of like exercises you can do while you're pregnant, because yes, you should do them. But the reality is we have multiple research papers that show this. If you carry to full term, you are going to get an abdominal separation.
You are.
So I think that there's a lot of fear out there of people who are like, oh my God, I can't, like I've got my abdominals are separating. This is really awful. Everything is awful. It's like, if you're carrying to full term, your body has to give somewhere, and that's the natural place where it's supposed to give. The problem comes when that doesn't knit itself back together within those first 8 weeks. So if that hasn't happened in the first 8 weeks, naturally, you definitely need help outside of that, because it's not going to, I mean, it will continue to get a little bit better on its own over time. So we've seen some improvement in the separation and the integrity, even 2 years postpartum. But it's not the huge jump that you see in those first 8 weeks. And it doesn't mean that you need to wait 8 weeks either to start doing things that can draw the abdominals together. So Erica, I'll let you talk a little bit about some of the exercises, or kind of how you look at that.
Anything pregnancy, and then I guess also postpartum, like how quick you can do it and what you can do. Yeah.
Great. The first thing I want to say, I hope this is okay, is as a PT, this crunch and poke is so important. It's important to do that evaluation and get evaluated in that way. But I have clients that then decide to do that on themselves at home constantly. And I have to say, please don't do it at home on yourself constantly, because that action of crunching will make it worse. So let your PT evaluate you and then do safe things. So during pregnancy, what we like to do is we like to do a sort of mobility stability evaluation to look at where is there a possibility for stretch in the body to accommodate baby. And so if there's a lot of locking down in the lateral raphe or the semilunar lines, or they're really an oblique gripper, they're not a breather, then they're more likely to have the stretch of the linea alba be larger than it should. And so we want to already at the beginning of pregnancy start to open up the tissue in a way that will accommodate baby. So that's one thing that can be done. So some really, really good diastasis prevention prenatal stretches. But the main thing is to avoid the things that are contraindicated. A lot of people think they're doing something good for their bodies by working out when they're pregnant, but there are so many exercises that can make you more likely to have a diastasis that doesn't heal on its own. So we actually, if somebody's even thinking about getting pregnant, we have them stop doing rectus abdominis and oblique work entirely and just focus on the transversus abdominis and that patterning of intra-abdominal pressure and patterning between pelvic floor and TVA. So no crunches, no planks, even though planks are neutral, very few of us can do it just isolating our deep abs. And then being careful about moments in your daily life that are like a crunch, like coming up out of the bathtub or rolling up out of bed, just being gentle and turning on your side and pressing up so that you're not putting that extra force forward. Anything that's going to put extra force forward with baby is potentially going to cause more of a separation. And then
you're really looking for the doming, right? Talk a little bit about the no doming.
Yeah. So yeah, a lot of my clients that say, I think I might have diastasis, they see there's this like the pyramid that is sticking out. And that's essentially organs and visceral fascia pushing through the two sides of the rectus. And we don't want to do anything that makes that happen. But I prefer to take it even further and say, even if you can engage your six-pack muscle without the doming, don't do it, because why? We can work on that after. It's okay to not work that one flexion muscle and work everything else. You can still be fit. You'll recover better from going a little easier on the abs other than the transversus abdominis, which can help with labor. The other thing that I hear people say when I'm like, yes, you should be evaluated for diastasis is, I don't know if you've heard this, is like, I have snakes in my belly. And it's like the intestines are so exposed that you actually see the feces moving. So if you have that, you most likely have diastasis. And I also see a lot of digestive issues from it. Women that are saying, I never had, acid reflux or diarrhea or, vomiting in my mouth, and actually that they have diastasis and the dysfunction in the intra-abdominal pressure is disrupting their digestion.
Amazing. And then I think we had one other question about, like, if you are, I guess, postpartum and working to heal your DR, what kind of exercises should you avoid? Like, is there something you should avoid if you're like really working on it, and then to not make it worse almost, right?
Yeah, it's the rules are the same, that you don't want to do any rectus abdominis work. So no flexion against weight or gravity. So no crunches, no roll-ups. I have them not do oblique work as well, because the obliques come and they hook into the linea alba and they pull. And in fact, that's why sometimes diastasis can be caused by, say, scoliosis or side bends, where you have this constant uneven tugging of the oblique. So we look at that as well, both prenatally and postpartum, correcting some of those side bends and twists in the spine. So no oblique work and no rectus work. And then really it's to connect in either through, a PT or a postpartum exercise specialist, what the TVA engagement and the pelvic floor engagement should feel like together, and then engaging them well in everything that you're doing, in every movement that you're doing.
Yeah.
I'm laughing, Erica, because I many years ago went to a Thunder from Down Under show in Las Vegas back in the day, like the guy, like the Magic Mike guys. And they all had these terrible diastases because they just like way overwork their obliques, and then their obliques like hook in and pull their abs apart. And for me, I was like, I can't even enjoy this show because all I can see is like how dysfunctional your abs are, and it's like totally grossing me out.
That's so funny.
It just took me back there for a moment.
It's not just
a pregnancy talking thing about that.
Yeah, it's not just a pregnancy thing.
No, there was this phase where trainers were like throwing medicine balls at men while they were incline bench side crunching up, and they all came in with diastasis that year. So yeah.
Oh my God.
So I would just like, when I would go work out at, whatever place that I'd like to go, I would be like that one person that wasn't listening to what the teacher was doing during the ab workout. And I would just do my, simple leg marches that, my PT would recommend. So, and I kept that up for a while, and
That's great.
You know, yeah, I mean, I just didn't want to mess it
That's
up. I
fair.
was afraid
I
to.
think that's the hardest thing for a lot of people is because so many
Yeah.
people want to feel a burn and they don't understand that you have to have that neuromuscular like programming underneath it all in order for the muscles to function properly. You have to program that before you can start moving into exercises where you feel a burn because you're getting the burn in the wrong place. Like that's not what you're trying to achieve. And so I think people do sometimes get a little bored with some of those, like what we would consider like a low level or a basic exercise, like laying on your back and tapping your toes. But what you're doing and what you're focusing on with that movement and what you're integrating is like it's foundational for all other movement. I mean, laying on your back and tapping your toes, put that up, that's walking, right?
Yeah. I think I mean, there's such a stigma around it, right? Like you think exercise and you think sweating and working so hard. And I think it's also, you know, I love that you, Elizabeth, you said it was like your self-care, like you did it every week, you were consistent about it. It requires that. And it doesn't happen overnight, right? Like, it's not going to just be like, oh, I go to a PT like 3 times and I'm like healed. No, it requires that like maintenance around it and like actually investing in yourself and like spending the time to like make yourself feel good through all of this change, specifically pregnancy, which I think is, yeah, wonderful. I think I mean, for me, when I think of pelvic floor, I need to pivot a little bit to Kegels because I think there's like so much talk about Kegels. Are you doing your Kegels? Like, I feel like people come over and like ask me that. Oh, I'm doing them right now. Liz, can you talk a little bit about Kegels and like, are they an important thing to always do? And I'm sure, Erica, you have what to add to this?
So
I have heard
I call them pelvic floor contractions because Kegels were named after a man, right? So our pelvic floor spaces or pelvic floor contractions are when we tighten the opening of the vagina, like you're stopping the flow of urine, and you're tightening in the back, like you're holding gas back at the same time. So you're trying to tighten those sphincter muscles, or sometimes I'll liken it like if you were going to try to draw your clitoris and your anus together, or if you're going to try to draw your sit bones together and then draw up and in and lift. And that is a very important exercise for people who need it for particular purposes. So not everybody needs to do a bucket load of Kegels before they have a baby. So if you have a really well integrated pelvic floor with your abdominals, like if you're Erica and you go to have a baby, like you're probably functioning really well, and a lot of functional exercise where she's engaging all of the muscles together will work really beautifully for her. Whereas another person who's extremely disconnected may need to do the Kegels just to connect first and gain that understanding, and then they can begin to integrate it into their full body exercise. But if you have a history of tailbone pain, painful intercourse, maybe just pelvic pain syndromes like painful bladder, endometriosis, then trying to squeeze and tighten the pelvic floor muscles more is creating a dysfunctional pattern, just like Erica was talking about with the obliques, where the obliques were gripping the rectus and separating it. If you over grip your pelvic floor and tighten it too much, it no longer has the flexibility that it needs, and it also loses strength. So if you think about an arm that's been in a cast, you take that cast off, and now it's stuck in kind of this position, you've shortened the muscle. And then when you try to go to strengthen it, you don't really have much range of motion to get that bicep to work. We first have to work on trying to lengthen and create space, those muscles and that fascia, and then we can start to work on the strength and that connection there. But sometimes it takes actually opening the muscles up first before we can start to reintegrate the contraction and how it works with the other muscles in the body. So no, I'm not one of those people that tells everybody to go do your Kegels. I think it's a little more nuanced than that. And I think that can be really frustrating for people because they're like, well, how do I know if I'm the person who should or shouldn't do the Kegels?
That's not the work. Like, I feel like people are like, well, I do my Kegels, I don't have to work on my pelvic floor. And like, clearly, I think from this conversation, it's not that. Like, that's like, I think what we're right. Like, I just feel
and you can do Kegels in all kinds of dysfunctional ways. Trust me. I think the research was that like 30% of people who do pelvic floor exercises do them incorrectly. And I can't tell you how many people I have who come in, and even though they think that they're doing the right thing, they're absolutely not, or they don't have the correct coordination with the abdominal muscles. So your transversus abdominis is supposed to naturally engage with your pelvic floor. But what you'll see sometimes is that transversus abdominis will over-engage and then push everything out of the vagina like a toothpaste tube, or it won't engage at all and your pelvic floor is gripping. Or sometimes the layers engage differently. So we've found through research as well that people who engage the deeper layer of pelvic floor muscles before the opening layer, or just the deep layer and not the opening layer at all, are much more likely to have urinary leaking and incontinence than those who engage the first two layers simultaneously with the deep layer or as a pre-contraction before the deep layer. So sometimes it's just even trying to talk them through how they're tightening the muscles and in what order, and are you feeling like, okay, first they grip their transversus and then the Kegel comes on, or pelvic floor contraction, or the pelvic floor contraction and then the transverse abdominis. Like, how do you get that to work as like a smooth integrated system? And are you overusing other muscles? Are you gripping your butt, which is then tightening your tailbone and making it harder to go poop? Or are you using your inner thigh muscles and you wonder why you've got pubic bone pain, right? So, and your inner thighs are sore all the time because you're not using the right muscles. So it's really, really common. One of the best analogies that I will give if you want to do a quick test on yourself. So don't do this if you have placenta previa or an incompetent cervix and you're pregnant, you've had recent vaginal bleeding. But if you take a clean finger and you insert it vaginally, the two functions you should feel in the vagina is you should feel something closing around the opening of the vagina, like a purse string. So if my finger's in my mouth, you should feel this.
Right.
So I'm closing my mouth like an O. And then you should feel something lifting your finger up toward your pubic bone. So if my tongue were going to lift my finger up toward the roof of my mouth, you would feel that. And then there should be a slight drawing in, like I'm sucking that finger into my mouth. So you should be looking for those three actions. And ideally, you wouldn't have the tongue lift happen before the lips. The lips. You wouldn't want the tongue lift before the lips. So if you're noticing that those things aren't quite there, you're like, man, I don't really feel the lips at all, or I only feel the deep, or, I don't feel anything drawing my finger in, something's not right. And you can do as many Kegels as you want. It's not going to do you any good because you're doing them wrong. So you need some guidance with that.
Awesome. Erica, anything you'd like to add to that?
That was fascinating. That was so interesting.
Yeah,
I mean, in our format, we don't get to do internal work, right? So sometimes we're just trusting that someone is engaging well, even though there are signs externally. And so I do recommend people to go home and insert a clean finger and check it out. And we should all be checking that out all the time and seeing what's happening.
I don't think there's enough talk about that. Like, I think we got to know our body in order to make it the best it can.
Yeah, and touch feedback is so helpful. And I very much agree with Liz that the stretching of the pelvic floor, getting it to open up and take it out of that lock or that trauma so that it can then be supple and responsive, is usually the way that it needs to go, as opposed to just, these spasmodic Kegels that people are often doing badly. So yeah, adding in awareness and stretching and touch feedback is great.
Yeah, and I would just want to throw into that, because I know, Elizabeth, you had tailbone pain, right? I think you shared that with us, and that might have been before we started the recording, or maybe you said it. It's stuck in my brain when you said that. And we have muscles in the pelvic floor that attach to the coccyx, right? So our tailbone. So if you're doing a ton of Kegels, you're probably making your tailbone pain worse. Also, doctors tend to give these really awful donut cushions for us to sit on postpartum, because all they're thinking about is the vagina. They're not necessarily thinking about the tailbone. So it's much better if you get a wedged cushion that can help support the lumbar and has a V cut out in the back. So there's absolutely no space for the tailbone to compress with something. If you're sitting in a really soft sofa, you might consider getting to a firmer surface, or putting a piece of plywood or something underneath your sofa cushions so that you're not sinking into that. And it can be a challenge if you're having issues like prolapse, where you feel like you need to strengthen the pelvic floor, but then your tailbone is hurting, right? Because every time you go to do a Kegel to try to lift your prolapse, you're just tightening around your coccyx. And that's one of those situations where we need to address one of the pieces of dysfunction first, like the tailbone. And then once that's feeling better, we can move into strengthening for the pelvic floor or the pelvic organ prolapse. And I know you're probably going to want a definition for that too. So pelvic organ prolapse is when the organs of the body that should be inside of the body start to droop and lose their ligamentous integrity. So they start to drop in the body. So that's why, again, when Erica was talking about how fascia is important throughout the body, right? when those ligaments start to drop and we lose that fascial integrity, it starts to kind of bulge out of the vagina. So people may experience that as like feeling a bulge there that they didn't feel before, or like a tampon is stuck there, or just a general heaviness.
Yeah. And yeah, you answered that question about tailbone because someone emailed in and said it still kills 5 weeks after birth, and sitting is an issue as is connected to the pelvic floor. So I hope that answered that person's question. Yeah.
Yeah, and it may have also been related to their birth, right? I feel like in the
Yeah.
United States, a lot of people in vaginal childbirth are encouraged to be on their back.
Yeah.
And then the tailbone has no space to move. So even if you just ask them for a bag of saline or something to put underneath your tailbone in childbirth, it just creates like a waterbed. It just gives some movement for the sacrum. So our, you know, when we're having a baby, what we want to see is we want to see the sacrum extend here. We want the tailbone to be able to have room to extend like this. But if there's a hard surface under it, there's nowhere for it to go. And then people end up with tailbone injury.
That is a great tip, that waterbed. And like, I just remember lying on my back for way too long during birth. And
yeah, and you know, and they let people roll to their side when the baby's in distress. So why can't we just like help people roll to their side for a little while and let them push there if they need to? And mostly it's because it's inconvenient for the person who's delivering the baby.
Yep, exactly.
Or if we could birth on all fours, hands and knees, where you can really arch and lift your tail is so great, or squatting. Some hospitals are allowing that. I also find with tailbone pain that, you know, as baby's coming down, the pelvic inlet will open for baby to drop in, and then it's supposed to swap and the pelvic outlet opens for baby to come out. And what happens?
Show that.
Yeah.
So like here's the inlet, and then here's the outlet down here. So this has to open here for the baby to drop in, and then it has to do the opposite and open that way for the head to come out. That's what she's talking about.
Magical
opening,
that we can
closing.
do that, right?
Speechless.
Like a butterfly.
Speechless.
Yeah.
I can't even. What
happens in hospitals in the US often, or in Western medicine births, is it opens and baby drops in, and then something goes on where the doctor wants to rush the pushing, rush delivery, and there's an intervention, and the pelvis is not allowed to take the time to make that other switch, or C-section happens at that point because there's distress. And then the pelvis, as they come back postpartum to us, and the pelvis is locked with the pelvic inlet open and the pelvic outlet closed. And there's a lot of tailbone and SI joint pain from that. So we have to actually manipulate the bones back to where they need to be and then restabilize that.
It's actually better if you're on your back to turn your knees inward to open the outlet when the baby comes out. But the traditional position we always see is on your back with your knees all the way up and out, and that closes the outlet.
Yeah. And it makes it harder to access the right core muscles. It's just, the whole thing.
Can you, like, I guess, can you ask the doctor or the nurses while you're in there, do you recommend anything like while you're in, because a lot of time, like, you're in this distress and like you have to listen to what they're doing. I don't know if there's any like
I think it's really hard. You have that doula perspective too, Erica. I don't know if you spoke about that, but it's the advocating.
The advocating,
right.
Yeah, which I think is a big part of this and this conversation in general. It requires that.
Yeah. As a doula, the way that we look at the ethics of that is to say the more information that the mom has, the better plan she can make coming in. So if we just all are telling everybody that's listening today, it would be better to birth in, for so many reasons, your birth outcome would be so much better if you don't birth on your back. Now they have that information, and then they can ask their doctor ahead of time. It isn't in the moment in the hospital that you have that conversation. You make your plan ahead of time. You talk to your doctor ahead of time, and you walk in with that plan, and you make sure your partner's on board or whoever's birthing with you. And then, of course, that is the job of a doula, is to sort of say, hey, to be the annoying one that says, hey, can we stand up for a minute?
Yeah. My doula came late to my birth, and because I wasn't actually induced. And when she got there, I was like moved around, like it just became, it's hard. And like, I'm here for all of you out there who are about to give birth, but really, I feel like take this advice and ask the questions that you have, and just go in there with the most knowledge you can, because it'll make for such a better experience. And like, you know, your body will feel good. Your body will thank you. Your mind will thank you. And I think it's just, you know, knowledge is power. And that's part of the reason why we're doing what we're doing, because, you know, you don't have to do this alone. There's so many people out there who have gone through it and like have learned from it and can help you along the way. So I think that is something to definitely
Yeah,
take.
if anybody took one thing away from this, it would be get a doula. If you ask me like what would be my takeaway, I'd say get a doula. Although I know that there were a lot of people who birthed in COVID and they, you know, maybe had their doula maybe on an iPad in the room, that they couldn't actually be present there for that. And I think sometimes it can be really hard when there's a lot of people in the room pressuring you to do something for you. You know, if you've got 5 white coats telling you need to do something, and you feel like you're not the person who has the authority to challenge that. You know, I found in general, even with myself, and I encourage patients to do this all the time, which is just ask the question of if there's a reason why we can't do it a different way. So they may be telling you, you need to do this, you need to do this. And it's like, well, is there a reason I can't do it on my side? Because there's not, and they won't be able to say, well, you know, they're not going to want to say, well, because it's easier for me to do it this way, right?
Exactly.
And just kind of puts that question back on them so that they can give you an honest answer about why they're pushing for a particular intervention. And sometimes interventions are important and needed and good, and they're doing it for a very specific reason, and they're going to tell you, listen, this needs to happen right now, or nobody wants to lose their baby. But is my baby in danger? Am I in danger? That's a really good question to ask too.
Yeah, 100%.
And I just want to say that if you go in with the perfect birth plan and you end up with interventions, there's nothing to regret or to be ashamed of.
Not at all. I mean, yeah, we can plan as much as we want, but I think really just coming with all of the knowledge around it is like where you can really set yourself up for success, and being okay with what happens, because at the end of the day, like, you want to have the healthy baby and you want to take care of yourself. So that's obviously number one.
And I did not plan to have a C-section for my first, and even for my second, I was hoping to have a VBAC. Yeah, VBAC, but it just didn't work out, and it's fine.
It's fine. You have 3 healthy babies.
Yep. Driving me crazy.
Yeah. Feel free again to chat any questions about what we've spoken about. One last question. I mean, we have 2 more questions. One I had here, and Eric, I don't know if you want to talk on this, is there's a real big craze postpartum around belly wrapping specifically. And I don't know, there's a lot of mixed feedback on that and how that kind of supports this. And I think Liz, Erica.
Oh, I got feelings, so I'll let Erica go.
Yeah, and I'm okay if our feelings disagree, because it's
cool.
I challenge all of that. I think that's the part of they might. So I'm just intrigued.
I think that belly wrapping in the way that it was done in certain cultures is wonderful. What we have turned it into here can be very harmful. So what I mean by that is, after having a baby, having a loose cloth tied around your belly to help with that sort of first 8 weeks when we're doing so much healing, and maybe just need a little reminder to be aware, to start to kind of reconnect neuromuscularly to the organs being where they should be and the TVA firing is great. Once we get it tight enough that it is pulling the 2 sides of the rectus together and we think, oh, that's great, that's healing diastasis. In fact, what it's doing is pushing organs down and making the pelvic floor harder to heal and potentially causing prolapse. Also, most women, when we say gently wrap, they wrap so tightly they can't breathe. And if you can't engage your diaphragm on your inhale, you're not balancing your intra-abdominal pressure and healing your issues postpartum. So we encourage wrapping, but we encourage it where you should basically not feel it at all. And even saying that, I still have clients that go buy corsets and wear them 24 hours a day, and it's not a good choice.
Yeah, you said that in such a more balanced, nice way than I would have, I think. I've had patients who really push back on it, and I say, okay, well, let's stand up. I'm going to insert my finger vaginally, and we'll see how your pelvic organs feel, and then you're going to wrap yourself, and then we're going to do it again. And I have them feel their internal organs pre and post wrap, and when they see how their organs have descended into their vagina and are bulging out because they're wrapping themselves so tight, it is a wake-up call for them to stop that practice. You can buy some really nice firm panel yoga pants that provide support. You know, there are some nice compression shirts out there, like postpartum
Yeah.
compression shirts that will do the trick without having to cinch yourself like Marilyn Monroe in the center. And you know, I used to get people all the time who did that for diastasis postpartum. They're like, but then I take the wrap off and I feel everything goes right back. I'm like, right, because you're not actually doing anything. In fact, if you wear that all of the time that tight, you're turning off your abdominal muscles that are trying to find their way to turn back on. So yeah, it's not great in that way. So 100% on I'm 100% feel exactly like you do on that one.
Amazing. I think that's really helpful because I think, you know, what we see on Instagram and what we see some of these celebrities do and put out there is like, it's hard. And it's, again, like, do the research, ask the professionals, figure out what you can do. So in the long run, you're really making, you're doing the best for your body that you can. Somebody did.
Oh, I'm having a burning question about the tips for actual labor and delivery.
Yeah, go for it.
And then if I were to say walk away with one thing from that, it would be a warm compress to your perineum.
Yeah,
so
and this
if you don't
tips we can have for actual labor and delivery. This is what,
yeah. So if you're actually in your pushing phase and pushing the baby out, the American College of Obstetrics and Gynecologists, this is on their recommended to-do list to help reduce perineal tearing. You just get a warm compress. So it can be a hot washcloth up in a ball, and they just need to place that right over that muscle between the vagina and the anus and provide support there while you're pushing. And that will reduce, that's been the one thing more than anything else that's been shown to reduce perineal tearing. So, you know, we've talked about the position of the hips, being on your hands and knees, tall kneeling, all these other squatting, all these other things you can do. But that's one thing that you can ask your provider to do for you, is to put that compress there.
That's amazing.
Liz, can I ask you a question about that? I have heard conflicting ideas from obstetricians about if there's evidence that perineal massage prevents tearing. I thought that it did, and then some of them have said there's no evidence that it helps. What do you think?
There absolutely is. So we have some really good randomized controlled trials that show that. There are studies that show that perineal stretching in labor can actually cause increases in tearing. So I think that it gets a little confounded between stretching the perineum during childbirth versus doing it beforehand. So the idea being that if you do it during childbirth, it can cause actual increased swelling to the labia, which will then cause it to burst open more easily, like kind of like a ripe fruit. So, you know, that's another thing. You want to be mindful of your fluid intake when you're in labor. If you've got a nurse that's hanging IV after IV after IV and pumping you and making you puffy vaginally, your vagina is going to be more likely to tear than if you were managing your fluids appropriately.
Yeah, I guess. And then the question is, when should you start a routine of perineal massage, which
Usually it's between 34 and 36 weeks. So once a week is great. And then it's like, basically the way the study goes is twice a week is better, 3 times a week is better, 4 times a week is better, 5 times a week. It's like, it goes all, they studied it all the way up to like doing it daily and realized that like
multiple times a day.
The better it gets.
Twice a day.
You do want to be careful if you have like a history of pain and you have soreness afterwards. You really shouldn't be sore after you're doing your perineal stretching. You should maybe feel pressured during the moment, but it shouldn't be sharp, numb, tingling, painful in that way. And so if that's lasting afterwards, you probably do need a day off to kind of recover and then try it in a less aggressive way.
And this is just pregnant. Sorry if this is dumb, but this is just during pregnancy, or this is.
You would do that during pregnancy, but you know, we do a form of it afterwards if you're recovering from a tear and you need to kind of, and that muscle, sometimes physicians will give women what we call a husband stitch. Well, they're tie it too tight, actually. That's supposed to, husband stitch to make it the vagina tighter for the husband. In those cases, we may need to like work on opening a little bit more so that they can participate in penetrative intercourse.
Well, this was very informative for me. Is there anything?
This is amazing.
This is amazing, right? I hope everybody else got as much out of it as I did, and as Elizabeth did. Liz, Erica, anything else you want to end with on this topic that you want to leave everybody with? I don't know if there's any.
I think that I would just like to say that we're sharing this information as women and women who have given birth, and really from that perspective, primarily. And that was the thing that I was the most shocked about when I had kids, was that I didn't know any of this stuff, even though all my friends had kids, because nobody told me. So tell each other everything. Let's share this information with each other and what we've gone through postpartum, so that it can just continue to be easier for everyone.
Yeah, I'm literally gonna text all my friends about that who are pregnant, that warm compress on. Like, I love that idea. I feel like, yes, I agree.
Saline bag. Yeah.
We will be sharing out a link so you can share it with friends if you weren't able to tune in. And then on the last note, Elizabeth, somebody wants to know where the artwork behind you is from. So
I don't know. I actually don't know.
This is what we get from Zooming from our homes, right?
Yeah. Thank you.
Well, I want to thank you guys so much. We will be sharing more information on Origin, on Erica Bloom. And I really hope this was helpful for everyone. It was for me. So thank you for spending afternoon/evening with us. And have a great, feel good. Reach out. You can reach out to events@hatchcollection.com if you have any questions, and we'll be sure to send you more information from everyone here following the event.
Thanks for having us.
Thank you guys.
Thank you.
Have a great evening.
Thank you for letting me join. This is awesome.
For being here, and thank you, Elizabeth. I mean, I feel like it's so important to hear a perspective from someone that's gone through it and invested in themselves. And I will be doing that. That is my takeaway moving forward.
My advice to everyone. So I work, I mentioned I work in finance.
Yeah.
And so I work with like 95% males.
Yeah.
And I tell all my male coworkers who are expecting, get your wife to go to physical therapy. You are going to be thankful for it, because she's going to be like, my husband takes care of me.
I love that. Let's end on that. Thanks, guys.
Thank you.
Take care.
Everyone.
Bye.